Thanks so much for having me here. My name is Enrique Lin Shiao. I'm a principal in venture investments at the Cystic Fibrosis Foundation. I'm a trained scientist. I did my Ph.D. in genetics and epigenetics at the University of Pennsylvania, and then a postdoc in gene editing with Jennifer Doudna here at UC Berkeley. Something that really kind of captured my attention from the Cystic Fibrosis Foundation was the mission. It's such a clear mission. It excites me so much to be able to wake up every day and that this is my job, that I get this opportunity to think about how we could bring all these new technologies towards this really big goal that is curing cystic fibrosis. And if we can cure this single disease, then it really opens up so many doors for other diseases. All the challenges that we're trying to get to in cystic fibrosis, inserting a large gene into its endogenous locus, being able to deliver to the lung, being able to deliver exhepatically or to different tissues. These are challenges that go beyond cystic fibrosis and could affect a lot of other diseases. So for me, it's exciting to be here working in cystic fibrosis, but I do see that a lot of the work that we're doing could impact a lot of other diseases too. So overall, the mission, the community, and this opportunity to be able to do something so big and exciting. Yeah, I think it was a process. Once I left my postdoc and left the bench and went into a job in business development at LaunchBio, there was a big curve where I had to learn a lot of the lingo, a lot of acronyms, and I had to talk to a lot of different stakeholders and people who are part of this drug development process. And for me, talking to different people, thinking about that process more big picture has always been exciting. So it wasn't necessarily an easy process. It was maybe a bumpy ride at first. And I had to learn a lot of the finance parts, investment vehicles, how to negotiate contracts, talking a little bit about the due diligence, but also the legal diligence and the business diligence. So there's all these different aspects. But I think if you can go through a PhD asking a very fundamental question, you can also take all those lessons and bring them towards doing due diligence or learning something new relatively quickly. And I think I'm not unique in any way. I think anyone can do that. And I think it's exciting, and people should think a little bit more about how their scientific training really prepares them for a lot of jobs outside of being on the bench, and that those jobs can be just as impactful, just as rewarding, or even more. For me, I had no idea that a job like the one I'm doing today existed. And it's really exciting for me that I get the opportunity to do this on a daily basis. Let me tell you a little bit of the story of the CF Foundation. We are a foundation that has been around for almost 70 years now. And one of our core missions has always been to find new therapies and cures for cystic fibrosis. And you might be familiar with our story. We were early investors in a small biotech company here in the Bay Area called Aurora Biosciences. That company was really focused on doing high throughput screening to find small molecules that could really change or modulate the CFTR protein, which is defectous in cystic fibrosis. That company then was acquired by Vertex. We were early investors before that. We continued to invest throughout the process of developing these modulators. And today we have a treatment that treats about 90% of patients with cystic fibrosis. It's really an exciting story. It's also exciting to see how it's changed patients' lives. And when you talk to the community and you hear how they take the drug and after a couple of days they can already feel a big difference, it's really, really motivating and exciting. But at the same time, there's still 10% or more of patients where there's still nothing out there. They can't really use small molecules or modulators because the truncations that they have are very early, and a small molecule doesn't really help them. So we really want to be able to think about those patients and think about new therapies and cures for those patients. So one thing that came out of our investment in Aurora Biosciences is that we were able to sell the royalties and get about $3.3 billion back to the foundation. And we're now investing $500 million in what we call Path to a Cure towards genetic medicines, really for that 10% of patients where there's nothing out there right now. And we think if we can find a cure there, we can also extend it to the 90% of patients currently using modulators, where some patients cannot tolerate modulators, or there's still some symptoms that are not necessarily gone with modulators. So let me tell you a little bit about how we are thinking about other ways to help our community. One of them is we're also investing up to $100 million in infectious disease. There are different symptoms that persist in people with cystic fibrosis, for example, antibiotic-resistant infections. And one of the things that the community told us several years ago is we want you to focus on this as well. So we've invested in multiple companies really thinking about new ways to target antibiotic resistance. And that can include anything from phage therapies to other innovative strategies. But beyond capital, we also have a lot of other resources that we provide for our community and also for the companies that we work with. We have our own labs, 45-person lab in Lexington in Boston, with best-in-class assays. We have the largest patient-derived cell bank there. We have all kinds of in vitro experiments there and assays that can allow companies to go through our preclinical development plan. And then we also have the Therapeutic Development Network, which is a network of 100+ clinical trial sites in the US and abroad for clinical trials in cystic fibrosis. And because we've been around for almost 70 years or more, we have experts in academia as well as in industry that can also aid this process. But then beyond our investments in industry, we also have academic investments. We have grants that we provide to academics. There are basic questions still in cystic fibrosis that can really only be answered in academia. So that's one of the areas where we invest a lot too. And then we also care a lot about supportive care. We have different groups within the Cystic Fibrosis Foundation that are focused in access to medicines or policy, regulatory work. They can go to DC and advocate, for example, for different things that are important for the community too. We have, for example, the chairman of our board, and it's amazing to hear her story. And also, we have also met patients who are not eligible for modulators, and it's devastating to hear some of the stories and to hear how it can be very isolating to see a huge portion of your population, of the people with CF, being able to move forward with these new treatments while you're left behind. So that for me is really motivating to think about, okay, we really need these new treatments. We really need to think about how do we bring something for this population as well so we can all move forward with healthy and high quality lives. I think when we think about a cure, we understand that it might not be in the next 5, in the next 10 years. This might take a little bit longer. So we are always thinking about what other things can we be doing right now to improve the quality of life of patients today. So that's an area where the Cystic Fibrosis Foundation is already investing heavily and thinking about different ways to improve that. From my side, something that really excites me as well is having come from Costa Rica and growing up in Costa Rica, is thinking about cystic fibrosis more globally. And the CF Foundation has all these initiatives, for example, within Latin America, bringing together foundations across different countries in Latin America, where they might not have access to the same drugs yet, but they can share some ways in which they can treat their populations right now with the resources that they have. And I've been able to meet with those foundations, and it's been extremely rewarding to see what they're doing and how CFF is also helping there. And then on the other side of the world, we're also thinking about, for example, in India, we know that there are patients with cystic fibrosis, but we don't understand what are the mutations that they have. So part of the foundation is also thinking a little bit about how do we identify those mutations and how do we learn how to treat them as well.